Welcome to the Mental Health Book Club podcast with your hosts, Sydney Timmins and the Secret Psychiatrist. We would like to take this opportunity to let you know that we will be covering a diverse range of mental health topics that may be distressing to some listeners. You can find a full list of the topics being covered in our show notes. Please check the show notes before listening to any of our episodes. Welcome to the Mental Health Book Club podcast with Sydney Timmins and the Secret Psychiatrist.
Hello, I'm the Secret Psychiatrist. I'm a female psychiatrist currently in London working in the NHS, and you can find me on my website www.thesecretpsychiatrist.com, Twitter, Facebook, Instagram, and also on this podcast.
This is part 2 of our discussion on perinatal psychiatry, so that's everything to do with mental health and pregnancy. So with this discussion, we will start straight away with where we left off in the last episode.
So symptoms of bipolar in pregnancy, the symptoms are slightly varied, but similar to bipolar, obviously. So you could be irritable, manic, tearful, decrease in mood. You can feel a bit confused. You might be paranoid, suspicious. You might have odd beliefs. And this is when we're thinking also about possibly psychosis, because it increases your risk of postpartum psychosis. So you might have delusions, hallucinations, auditory, possibly hallucinations. So a hallucination is you're seeing something or hearing something that's not there. And we're not quite sure why, this happens. So some people don't know they have bipolar until a pregnancy hit, basically. And we're not quite sure why. I think it goes back to what we said earlier, that it's a hormone imbalance, not sleeping enough, and the stress of the birth. It can be quite traumatic for a woman, and that can sometimes stress, the body and the mind. And then you might find you've got a diagnosis of postpartum bipolar, for instance, or you might go into relapse. So it's it's a lot to do with stress, actually, I think, in general, with your hormones and your body and mind. And I wanted to touch on postnatal blues and depression. Postnatal blues is really, really common, and that doesn't mean you have mental health. It happens in must be about 3 out of 5 women, actually. It's over 50% experience postnatal blues, and lots of people don't talk about it, so they get really worried. And this is an article that I've done with Harness magazine that will come out. So postnatal blues is essentially, soon after birth, you kind of have the symptoms of feeling a bit stressed, a bit tired, thoughts of maybe not wanting to be with the baby, lack of energy, not enjoying things, finding it difficult to bond with your baby or concentration. And usually it happens in the first week of the newborn, and it usually resolves within 2 weeks. But if these feelings are lasting longer, up to a year after having a baby, it sounds like then you're having postnatal depression. And that's much more serious, obviously, because it's essentially depression after you've had a baby. And so we'd be worried, thoughts of harming yourself or even the baby. And people get really scared to come forward. And I think it's a number of things why. I think one of the main things, people are worried the baby's going to be taken away from them.
I think that's huge, don't you?
Yeah.
I think that would, if it was me, that would probably be my number one priority of worrying that someone's going to think that I'm unfit and they're going to take my baby away from me.
Yeah. I think that's completely, I think that's completely understandable.
Of course.
Yeah. And they get really worried safeguarding's going to be involved. But, I will tell you, babies won't be taken away. That's really rare. And only in exceptional circumstances of incredibly severe cases. Most of the time, that never happens. So anyone suffering, please get the help you need, because you will make it worse for yourself, actually. And you don't want these symptoms to carry on, and your baby won't be taken away. That rarely happens.
And there's something you can do.
There's something you can do, and there's so much support. You just have to be willing to take it. So I mentioned I know somebody that's going through postnatal depression, and they've never sought help, and it's such a shame. And you can't force somebody, unfortunately, unless it's exceptional circumstances. But you suffer so much, and so does your children and your family, and it's terrible, and it really impacts your life, and you shouldn't be living like that. So I completely understand those concerns of, it's terrifying as well to have these thoughts, especially women who have thoughts to harm their baby. It can be so scary, and to make sense of it all.
And also a bit shameful, because you're like, I have this beautiful baby, and now I have these thoughts that are not what should be happening. This isn't meant to happen to me.
Yeah. I think that's absolutely right. And you think, you're a bad mum. And, it's a terrible feeling, and a lot of guilt, I think, sometimes as well.
Definitely.
So 1 in 10 women can experience postnatal depression, and
wow, that's higher than I
it's
thought.
high. That's what I mean, because people don't come forward, and hopefully that's something a bit comforting for people hearing.
I think that's hugely comforting.
Yeah.
1 in 10.
1 in 10. And I wanted to mention about men here. So partners can also suffer, with 1 in 25 men suffering postnatal depression as well.
Wow.
So that's...
See, now that's something that I don't think most people would know, because it's, sorry men out there, but it's not one of the things that kind of immediately jumps to your head going, hang on, what about the guys? And of course they're going to have there's going to be something impacting them as well. They're not immune to this stuff.
I think people think men are immune to it because they haven't gone through the pregnancy or the birth.
But they've kind of been there all the way in some ways. Yeah,
they have. And I mean, having a baby is a partnership. Just because men can't, have that baby within them, it's a partnership when you've had that child, and it can affect them as well. So, I mean, men's, especially fathers' mental health so people don't talk about it again. Men don't come forward. They again feel embarrassed. They don't know how to make sense of it and the stigma. But I hope any fathers listening out there, you're not alone. There's lots of dads also going through this, or might one day go through this as well. And there's lots of support groups as well. So you're not alone. So please never think you are. It's not just the mum, it's the dad as well. So I want to talk about the causes. Again, quite varied, but you're most likely to suffer postnatal depression if you've experienced postnatal blues, already suffering from mental health, or have a lack of support around you, or have suffered from stressful life events. But you can also, suffer postnatal depression without any obvious cause. As we've said, having a baby is stressful in itself, isn't it? Treatment, again, quite similar. So the first thing I always say is, get the help you need. The doctor, midwives, tell someone. Don't be scared again that your baby's going to be taken away. It's so very rare. There's lots of self-help, and self-help's really big with postnatal depression. So there's lots of books or CBT, and looking at, because you have to remember, being a parent, you don't get much sleep, especially initially, and that causes a lot of stress. And people,
I bet.
And if you think
I'm
about,
so grouchy.
Yeah, I was about to say, if you, I can imagine if you didn't have a night's sleep, you'd be like, the very next day. So imagine continuous like that. So it really affects you physically and mentally. So looking at what you're eating, obviously eating well, making sure, you do exercise as well. I mean, it's the general things that really help, that are so important. And looking at your routine, making sure you're getting the sleep, getting up when you need to. I mean, it's quite difficult. Obviously, you're alone, a single parent, but try and get that support if you can. Like I said, CBT as well. You can do online if you don't want to see anyone. And obviously, if it's really, really severe, then medications, antidepressants, for example. And again, just want to say to all parents out there, you're not alone. Lots of support for you, and you're a good parent, even if you're going through this.
And it's also not weakness to decide that you do need to take a medication.
No.
I think that's also another thing that people are like, no, I don't want the pills. But if they're going to work, take everything they give you.
Yeah. Hey, that's really interesting. Do you feel like then it's a weakness, people think?
Me personally, no, because I take the drugs.
Yeah.
But I said to my dad the other day that I take antidepressants, and he was like, what do you need those for?
Right.
You don't need those. That's because I take them.
Yeah.
So, and the other thing, he was sat there and we were discussing his work, and he went, so-and-so's such a woman because he gets so stressed and he has to go and take all these holidays.
God.
And I'm like, but why?
Yeah.
Number one, I'm offended because you're saying that he's such a woman.
Yeah.
Number two, why can't he have emotions? Why are you so set against him having emotions? And I bet if he turned around and said, oh yeah, I'm taking drugs for this, he would probably have his own opinion that I'd want to give him a slap for.
Yeah. No, but it's true though. It's the same with homophobia, like especially in certain countries. People, unless they're going through it, some people, obviously not others, they won't understand it and they have no compassion. No. And I think you're right. It's men's attitude as well. Some men's attitude to men.
It's mainly been men towards men that I've seen. I think most women be like, you're taking drugs? Oh, that's good. Yeah. Is it helping? Whereas, I don't know, maybe it's just my family, so they're quite working class.
I don't think it is though, honestly. Like I know a lot of men that I've seen go through depression and they refuse to even get therapy, and I know quite a few men that do this actually, that they rather buy a book or something where they hide behind it instead of just going out and getting the help. And I remember someone I know, I actually made an appointment for them to see sort of an intensive therapist because they really didn't want to take medication. They were so ashamed of it. And they didn't even go to the appointment because they're just so embarrassed. And it's such a shame. And I really hope, more and more men come forward and talk about, their mental health, because there's nothing to be embarrassed about. And it's so common that men would be shocked if they found out actually their friend even is suffering.
Exactly. And I definitely say that if you are to get therapy, it's one of the best things I've ever done. And I wouldn't be sat here without therapy.
Yeah. Oh, that's really great, honestly. But yeah, hopefully, people less stigma. And I mentioned in the first podcast I did with you, so much stigma, even against doctors. So, some of my orthopedic friends are very anti-therapy because men don't go through this. But, a lot of my psychiatric male colleagues are so pro-therapy, but it's also the education, and they understand. And they know it helps, and they've seen it, and they're not, I think psychiatrists are not afraid to talk, because obviously that's what we do, but so they're really in touch with their emotions. And that's why a lot of men don't have respect for men in psychiatry, because they feel it's a bit sort of soft,
but it's not,
doctor career. But it's not, they're very strong men.
All the things that you guys do, exactly. Like, I don't think I could deal with half the things you deal with.
But that's the thing, that men just need to, and women as well, like you are, just come forward, and hopefully more people will know they're not alone.
Yeah, I'm very much more for talk about it, because it's good, and I try and be as open as possible because I want people to feel that they can talk about it.
Can I just ask, were you always like that, or did it take you a while to...
Oh, okay. No, I had it for a long time. So until I was diagnosed with borderline personality, all of the issues I had, I hid. I mean, I self-harmed for years before I got any help. And I just thought it was me because I'd done it for such a long time.
Right.
And it was only when I got to a point where I was suicidal and I scared myself that I went, there's something that's not right. I've got to do something about this. And Lawrence basically dragged me to the doctors, and then we went to the hospital because they wanted to do a full assessment with a psychiatrist and get a proper diagnosis, which I did. But even then, I was reluctant. I was like, no, I really don't want to. I literally said to him, look, you need to take me out in the car right now, otherwise I'm not going. It's almost like you're going to have to drag me.
What was stopping you, though?
I was scared. I was petrified. I was concerned about the judgments. People were going to think that, why hadn't she got help sooner? Because obviously it had been going for such a long time. And also, why was Lawrence putting up with me? I was scared that the doctors might turn around and say, why are you with her? She's been violent towards you. She's being violent towards herself.
Really?
It's just that I was so scared. It's that fear.
Yeah.
And one of my biggest things is that I don't feel good enough in anything. So that's, I'm not good enough in relationships. I'm not good enough in writing. I'm not good enough in my own life. I'm not good enough, because that's the messages that I received as a child. And so I just was so scared that they would see me as not good enough, as being a human being and shouldn't be here. And it's, when you think about it logically, you go, what on earth are you thinking about? But at that time, that is how bad I felt. And the ironic thing is that when I moved to Australia, we lived in a house that was owned by a couple and their children. And their children were living in a house and we moved in, and it was kind of like a co-share house. And her father, because she also suffered with borderline personality, spotted it way before anyone else, and he gave Lawrence a book I don't like the book, it's not the best book about borderline, but it's called Stop Walking on the Eggshells. And he gave that to Lawrence and went, I think she's got borderline personality, read this book. And that was months and months before I got diagnosed at that point. And in some ways they also hid that from me. So, yeah,
Really?
so I walked...
When did you find out about the book then?
I saw him have it because I walked in and saw him talking to the guy, and they were handing over the book. And I had no idea that it was in relation to me. I thought he was being given the book so he could understand his daughter better. So, because we were living with her. And no one said, I think you've got some issues.
Anything to you. And do you wish they had?
I wish they had, because I would have gone to the doctor sooner.
But do you feel you would have, though? Or do you feel you would have rejected that?
In hindsight, I would like to say I would have gone. But to be perfectly honest, I don't know what I would do. Probably not. I probably would have got angry. I probably would have blown up. So I often talk about being like a volcano. So it kind of builds and builds and builds and builds. And then everything that's upset me, I kind of like explode. And I would have expected an explosive situation. Yeah. If they'd said anything.
I think that was normal though, because I think if someone said that to anyone, it's a bit of a shock to the system. Do you know what I mean?
Yeah.
I think that's perfectly okay. So when did Lawrence tell you about that conversation?
After I was diagnosed.
Wow, yeah. Okay.
And I kind of started reading the book too. And I also think that was good because as a result of reading the book, I was going, yep. Oh no, textbook case. But then I still didn't do anything else about it after that, if that makes sense.
Yeah. It's hard, isn't it, to get there? It is very difficult. It's a difficult choice to make. And I mean, even with myself, like if I just need to go for physical health, I will avoid it. I mean, even though I'm a doctor, I will avoid it. Yeah, awful. And I will wait to the very last minute until I really have to, because I can't do something myself. So I'll need the referral of, I don't know, something for my eyes or something or whatever it is. No, but I think we all hate going to the doctors, don't we? We never want anything wrong with us. I think it's one of those things,
isn't it? You're like, oh, again. In some ways, I'm worried that I'm going to just go and they'll tell me there's nothing wrong and I don't need to worry about it. Or they'll tell me it's something worse. Or they'll judge me for not coming sooner. It's all
it's very anxiety ridden. It's like the feeling I get when I go to the dentist. It's like, what will you find in there? Like, it's very invasive, I think, when you go to a doctor or a dentist, because it's, it's your body and you're kind of exposed and vulnerable to someone, and no one wants to hear any, bad news and horrible experience, I think.
Yeah.
Sorry, going back. So when you were diagnosed, how did you take it?
I was relieved, I think, and I went, okay, I have a diagnosis now. And for me, what really helped was that in some ways I kind of split myself, and I went, there was BPD me and there was okay me, and I needed to get back to okay me, if that makes sense. So I'm like, that's BPD talking, and that is sensible, logical Sid talking. And that's what I really liked. But there's a lot of discussion, isn't there, about how good a diagnosis is, particularly in terms of getting the treatment that you need, but also defining someone is difficult because people are like, I'm going to rebel against that, or they say it's too simplistic. I mean, there's quite a lot of discussion about whether borderline personality disorder should be a diagnosis or not. I know that Lawrence's therapist says that he thinks it will be removed. And I do think they discussed it last time they updated the DSM, whether to remove it or not. And in some ways, I think if they took it away, I would find it really difficult because you kind of, yes, I don't like BPD me, but it is me. And and if you take that diagnosis away from me... And I guess that's also a symptom of borderline personality, is that you struggled to identify who you are. And if you took that away from me, what are you leaving me with? Sorry.
Well, thank you for sharing that. I think, no, I'm really happy, and thank you, because they were quite personal questions. And I hope, everyone listening, can associate with you as well, whatever is going on, because you're very open, and I think that's great. And I think sharing your experience with your treatment as well and will really help people and connect with you. So that's great. So, well, that was basically perinatal psychiatry. If anyone obviously listening has any other questions or anything else, please let us know.
Exactly. We'll do our best to answer them. And what I will also do is I shall look for some specific resources that are going to be useful for parents to be, or if you're planning to become parents, or any of those kind of things. So if you do need additional support, there'll be some links on the show notes for you. So thank you so much.
Thank you.
Just a few pieces of housekeeping before we leave. I've changed around some of the books, so our next book will actually now be Stand Tall Little Girl by Hope Virgo, because I have already been able to do the author interview, so you will be hearing us talk to Hope about her book. We now also have a YouTube channel, which you can find a link in the show notes, and I'm currently uploading our current episodes, which is going to take me probably a couple of weeks, but I'm in the process. So until next time, it's okay to not be okay, and if you're not okay, talk. Thanks for listening to this episode of the Mental Health Book Club podcast. If you need additional help with your mental health, please contact the Samaritans on 116-123, which is a 24-hour helpline. And if you need additional information about mental health issues, please visit Mind at mind.org.uk. Our next book will be Stand Tall Little Girl by Hope Virgo. Our next episode with the Secret Psychiatrist will be on Attention Deficit Hyperactivity Disorder. If you'd like to find out more about the MHBC podcast, please visit our website, mentalhealthbookclub.com. We really hope that you enjoy this podcast, and we would like to hear what you think. Please head over to Twitter and follow us at MHBC_podcast, or head over to Facebook and follow our Facebook page, which is Mental Health Book Club. If you would like to show your support further, please share us with your family and friends and leave us a 5-star review wherever you get your podcasts. We are now on Patreon. Please head over to patreon.com/MHBC to donate as little as $2 a month to the Mental Health Book Club podcast. As a result of your donation, you will get early access to some of our episodes, you will get specific episodes that are only for patrons, and you'll be eligible to be entered into free prize draws.